Tonight, senior doctors say lives are being risked because of a lack of forward planning for the Women's and Children's Hospital. The Australian Medical Association has renewed its push for the hospital to be relocated to the site of the new Royal Adelaide. But while the Liberal Party this week showed its support for co-location, Labor's position isn't so clear. In a moment, we'll speak to Health Minister John Hill, but first, Caroline Winter reports on doctors' concerns.
Look at this one.
Little Maya Villana came into the world 10 months ago. She's the third daughter and final addition to the Villana family.
She's a very happy baby, very easygoing. She sleeps well, loves her big sisters, loves company.
Maya's birth should have been a special moment for parents Sarah and Mark. But as sometimes happens, things went wrong.
Initially, it hurt a lot that I was taken away from her, and I couldn't understand why they couldn't look after me at the Women's and Children's.
We think that patient safety is at risk. It's at risk now. We know that some patients aren't well served by being at the Women's and Children's.
Maya was born 2 months premature after her mum had an emergency caesarean section under general anaesthetic.
They were trying to wake me up from the anaesthetic, and I remember being awake and being unable to breathe. And at that stage, I think they must have put me back under the anaesthetic. And the next thing I knew, I woke up in a different hospital.
With no adult intensive care unit at the Women's and Children's, Sarah Villana had to be rushed to the Royal Adelaide to be put on a ventilator.
For me, I was torn as to whether I stay with my brand new daughter or I head off to be with Sarah.
The first time I saw Maya was from photographs that staff took at the Women's and Children's Hospital. These photos had been sent over to the Royal Adelaide.
18 hours later, she finally got to see her newborn baby in the flesh, and the family was reunited.
Emotionally really difficult for me to have to wait to see her, and whilst at the same time I understood that it was necessary to save my life.
Sarah Villana faced a similar situation once before. A fortnight after giving birth to her first child, Abby, she was moved to Memorial Hospital for surgery while her baby stayed in the Women's and Children's. The state's peak medical body says it shouldn't have to be that way.
We think that the future of South Australians would be best served by putting the paediatric, the women's hospitals next to the new Royal Adelaide.
AMA State President Dr Peter Sharley says the Women's and Children's can't cater for mothers who suffer a range of major complications during childbirth. He says that happens in about 12 out of 1,000 deliveries there, and as the complex nature and age of new mums rise, so too will that number.
We are seeing more diabetic women, we're seeing more obese women. These people run into more troubles more often and require specialist backup. So these issues are becoming greater as time goes on.
He says there are many reasons to co-locate the hospitals. Among them, facilities and medical equipment could be shared, including the helipad, which the Women's and Children's currently doesn't have. There would be support during difficult deliveries like Sarah Villana's, and mums and babies wouldn't have to be separated. More complex surgeries for children would have the support of the General Hospital. And there would be a better transition to adult services for children who have serious illnesses.
We need to ensure that when they leave the children's service, that they can move into a service that can care for their needs. And that is an issue at the moment.
Senior paediatrician Dr Michael Rice has worked at the Women's and Children's since the 1960s. He says it's an ageing, landlocked complex which has inadequate car parking and is delivering close to 5,000 babies a year, more than it was built for.
I think there are medical reasons, there are social reasons, there are reasons of looking at the future that say it is time to look at what is the future of the Women's and Children's Hospital.
All other mainland capital cities have done this, so we're not inventing the wheel here, we're just trying to catch up.
Perth is the latest to join those ranks. Building is underway to co-locate a new children's hospital with 2 adult hospitals, research facilities and eventually a maternity hospital. Paediatrician Dr Gervais Cheney says it's the way of the future.
Most groups who are looking for the long term are making this decision. It's not an easy one. There's a lot of emotional attachment to hospitals, children's hospitals and the sites that they're on. But in fact, looking at it as a best thing for patients, best thing for the children and their families, I think it's a very obvious decision.
But perhaps not as obvious to the state government here. It's understood an independent review by the Women's and Children's Board 4 years ago recommended an urgent review into the care available to women who are involved in high-risk deliveries. It also suggested co-location with a major general hospital be considered if deficiencies in care were identified. But the whereabouts of that report remains a mystery. At the new Royal Adelaide Hospital site on North Terrace, work continues. The jewel in the Labor government's health crown is due to be completed in 2016. The South Australian Health and Medical Research Institute is next door, but there's still land to build on. Just what will go there remains to be seen.
We want it to be earmarked for the Women's and Children's, the University of Adelaide Medical School and significant support services including pathology to support all of those hospitals. We're calling for a master plan that is going to help South Australians in the future. It's got to be cost effective to plan for the future and we're asking the government to put it in writing.
Anything that can avoid mother and baby being separated is a bonus. It's a really important bonding time.